Hello, Dr. Firnhaber here, and it's Wednesday, so it's time for 10 Minutes of Truth. So, as usual, today I have two dynamic, important articles right from the medical literature. One of them's so hot off the press, it's still warm. So, to help you understand how our bodies work and what not to do. So the first article is from a journal called Science Translational Medicine, and this is May of 2022. Now, this particular journal, Science Translational Medicine, I like it a lot because what the object of this journal is to take scientific research and show how it translates into everyday healthcare practice. So again, this is May 2022, fairly recent, not as recent as the next one I'm going to talk about. So the name of this article is Acute Inflammatory Response via Neutrophil Activation Protects Against the Development of Chronic Pain. Well, that's a mouthful, but let me explain what this article is talking about. So if you look at low back pain, especially is what they're discussing, but we're going to talk about a few other things too. Low back pain is the highest of all chronic pain condition in terms of years lived with. Low back pain is the number one chronic pain condition that there is. The current medical treatments for lower back pain include non-steroidal anti-inflammatory drugs, which are called NSAIDs, Tylenol, and steroids. And as stated in this article, all of these drugs are minimally effective. They don't work. Transition from acute to chronic pain is involved in the immune system, specifically the white blood cell or the neutrophil. And neutrophils are the part of the immune system that gobble up bacteria and things that shouldn't be in our bodies. That's when you get inflammation. Elevated neutrophils in acute pain is protection from transitioning to chronic pain. So anytime you injure your lower back and it hurts, neutrophils are involved, and it's involved in the inflammation process, and it's a natural and important process. The upregulation or elevation of neutrophils is inhibited by both steroids and NSAIDs. So what happens if you hurt your back and you take non-steroidal anti-inflammatory drugs, Tylenol, acetaminophen, aspirin, steroids, doesn't matter. What happens is that downregulates or suppresses the neutrophil production in the body. Well, according to this article, that leads to chronic pain. In other words, when you suppress that inflammatory response, when you get lower back pain, and you start taking drugs for the pain, that actually suppresses the healing process, and that can cause an acute situation to become chronic. And that's what this article is about. Now, they even looked at that with TMJ disorders, temporomandibular joint disorders. And their conclusion is that drugs that inhibit inflammation interfere with the natural recovery process, increasing the odds for chronic pain. So it's not just with lower back pain, it's with jaw pain, TMJ pain as well. And so the upshot of this is that we need something a lot safer and a lot more effective. Well, what would that be? Chiropractic care. Chiropractic care doesn't involve drugs. It doesn't involve suppressing the immune system. It involves taking pressure off the nervous system so the body can actually heal in a way that's natural and normal and safe for the body. So if any of you out there have acute pain or chronic pain and you're taking these drugs, basically you're gonna make that pain last a lot longer if you ever get rid of it at all. The worst thing that you can do for back pain when you get it is start taking NSAIDs and steroids. And yet, this is standard medical treatment. And this article in Science Translational Medicine says not only does it not work, but it makes things a lot worse. Now, the next article is out of another journal I like a lot. The name of the journal is Spine. This is August of 2023, so it's this month, hot off the press. Spine is one of the most authoritative orthopedic journals in the world, if not the most authoritative orthopedic journal. The name of this article is Non-Steroidal Anti-Inflammatory Drugs in the acute post-operative period are associated with an increased incidence of pseudoarthrosis, hardware failure, and revision surgery following single-level spinal fusion. So this study involved 179,000 patients, which is a lot of people, 50 to 85 years old, and it examined the effects of non-steroidal anti-inflammatory drugs and COX-2 inhibitors, which Celebrex is the primary one, on the healing of lumbar spine fusion, which is basically back surgery, fusing two vertebrae together. And what they found was that there's significant scientific evidence that both of these drugs, NSAIDs and COX-2 inhibitors, impact bone healing in a negative way. And the use of these medications is associated with a lack of healing of spinal fusion and the needing of future surgeries. Many surgeons are now recommending against the use of these drugs after surgery. These drugs have also been shown to impair healing during fracture. And there's been some very interesting animal studies that show that as well, is that if you break a bone and you start taking non-steroidal anti-inflammatory drugs for the pain, there's a much higher chance that that bone can't heal. It will not heal. It will not form a union to heal. So you need to stay away from those drugs. So these pharmaceuticals actually impair and inhibit healing once you've had spinal fusion surgery. Failed lower back surgery is a very bad thing, and it causes people to have more and more back surgeries. Well, now we found, according to this article, again, that just came out this month, is that taking these drugs after surgery is one of the worst things you can do. So as far as dealing with the pain after the surgery, that's not in my ballpark, since I don't do surgery. But if you want to make sure that the surgery doesn't heal, take lots of non-steroidal anti-inflammatory drugs or COX-2 inhibitors. So the long and the short of these articles is that these over-the-counter pharmaceuticals aren't necessarily safe for when you have pain. They can prolong back pain and turn it into chronic pain. They can cause surgery not to work and the necessity to have further surgery. And so chiropractic care, much safer alternative for back pain. We need to avoid these drugs whenever we can. There's other problems with these drugs. For example, they really alter gut bacteria in a negative way, and it's been shown they also alter hormone balance. They lower testosterone. Now that's for another talk, and I have a talk on that I do here in my office. So I would encourage you all, avoid these drugs whenever possible. Get something natural like chiropractic care and take care of yourself so you can live a long, healthy life. I'll see you next Wednesday.